No medicine can remove the cause of a lifestyle disease, but you can. Today, 90% of the patients seeking treatment in hospitals suffer from lifestyle diseases. But what diseases exactly falls under this lifestyle disease category? Lifestyle diseases include diabetes, hypertension, vascular blockages, heart disease, stroke, various types of cancers, allergies, asthma, rheumatic diseases and arthritis, kidney and liver diseases, digestive disorders, skin conditions like psoriasis, eczema, autoimmune diseases like SLE, thyroiditis, rheumatism, vasculopathy affecting blood vessels, neuropathy affecting nerves, hormonal disorders, mental health challenges, obesity, infertility, etc. comes under lifestyle diseases. The list is really exhaustive. In short, the root cause of most diseases treated with medicines or surgeries lies in one's lifestyle. This reality must be understood by patients and their families for effective treatment and recovery. Even complications during pregnancy, premature birth, birth defects in children, and mental health issues like autism are linked to the lifestyle of parents, according to modern research. Are medicines and surgeries enough for lifestyle diseases? It is time to start thinking seriously. Nearly 90% of medicines used worldwide and 90% of the surgeries performed today are for lifestyle diseases. This means that improper lifestyle is the root cause of most illnesses. If we can identify and correct these flaws, it is possible to recover from 90% of these diseases without medication or surgery, no matter how long one takes medication. If the lifestyle remains unchanged, the condition often worsens. The number of medicines typically increases and surgeries may eventually become necessary. Studies confirm that lifestyle diseases cannot be cured by medicine or surgeries because the root cause is not a deficiency of either but rather errors in lifestyle. That is why once a patient starts medication for diabetes, hypertension, cholesterol, or heart disease, they often have to continue them lifelong. Even after undergoing surgeries like angioplasty, bypass, or pacemaker implants, patients remain on long-term medication. Logically, shouldn't we aim to reverse lifestyle diseases through lifestyle modulation? Let us see how that is possible. To prevent disease or recover from any illness, optimal functioning of the immune system is crucial. Therefore, we must understand the relationship between immunity, disease, and healing. The real doctor inside us is our immune system, the body's healing power. The immune system maintains our health, heals wounds, and restores well being. It has two arms: inflammation, regulated by the omega 6 fat, and healing or anti inflammation, regulated by omega 3 fat. When toxins enter the body, the immune system triggers an inflammatory response. These toxins can include anything non nutritive, excessive medications, unsuitable foods, viruses, bacteria, alcohol, excessive fat or sugars, pesticides, artificial flavoring, colors, preservatives, and other chemicals. Study shows that a diet rich in omega 6 inflammatory fat and deficiency in omega 3 healing fats, along with the lack of essential nutrients, triggers lifestyle diseases. So we should start thinking about what we can do to strengthen our immune system and free ourselves from these diseases. We start thinking of illness only when we feel any discomfort or symptoms appear, or finding abnormal test reports in a health checkup. What is the relationship between discomforts and the immune system? Whatever the disease, we typically experience one or more of 5 symptoms: fatigue, fever, pain, redness, or swelling. These are signals from the immune system asking us to take action against harmful agents in the body. Most medicines relieve discomfort by suppressing the immune system's response rather than addressing the root cause. Instead, along with the symptomatic relief, if we support the immune system with the proper nutrient, it can destroy pathogens, repair damaged cells, and restore health and come out of these medications for symptomatic relief. The real cause of disease and poor recovery lies in the imbalance of omega 3 and omega 6 fats, nutritional deficiencies, and toxic overload that disrupts the immune system. The solution is to improve nutrition, including regular exercise, reduce exposure to toxins, and correct immune imbalances. This is the easiest path to health. In short, strengthening the immune system through proper lifestyle correction can lead to freedom from diseases and from long-term dependence on medications or surgeries. How can we make this practical? To achieve freedom from lifestyle diseases, the first step is to understand what we mean by term lifestyle. Lifestyle includes four main components. 1. Food and nutrition. 2. Mental and physical activity. 3. Mental and physical rest and sleep. 4. Extent of toxin exposure. The human body is made of around 57 nutrients. These include water, oxygen, 14 vitamins, 14 minerals, 20 amino acids, 4 fatty acids, and dietary fiber. The purpose of the body is to do physical and mental activity. Of all our body parts, we are able to control as our per will only the skeletal muscles, those muscles attached to the bones. The human body has around 650 muscles, 230 bones, and 230 joints. All other cells and organs operate involuntarily, automatically, stimulated by our lifestyle choices, both physical and mental. Unless we consistently activate our muscles through regular planned movements, the cells of our body won't receive proper blood flow. That means nutrients cannot reach where they are needed, and waste products cannot be removed efficiently. Exposure to toxins from the environment, food, or even stress can negatively impact our cellular health. And even nutrients like sodium, glucose, or fats, when consumed in excess, can act like toxins and contribute to disease. Only when we ensure that the body receives the right amount of nutrition, mental and physical activity, rest and sleep, not too little or not too much. And when we succeed in avoiding harmful toxins, we can truly achieve freedom from diseases and maintain good health. But how can we put this into practice? There is one important thing that everyone, especially those taking regular medications, must understand: the relationship between the medicine we consume and our immune system. Except for vaccines and antibiotics, most medications provide a relief from discomfort by suppressing the immune system in one way or another. In other words, most medicines negatively affect immune function. Additionally, medications increase the workload on vital organs responsible for detoxification, particularly the liver, kidneys, and even the immune system itself. Another important thing every patient should understand is a patient's role in drug pollution. Major part of the medications we take are excreted in urine, sweat, and stool. It will reach the groundwater, rivers, drinking water, plants, animals, and food products. That means the medication we take is becoming a threat not only to us humans, but to all the life forms on our planet. Therefore, it is essential to correct lifestyle, reverse lifestyle diseases, and come out of medications. To protect our children, grandchildren, and the coming generations from the ill effect of toxic pharmaceutical pollution, we should come out of the dependence on medication. We should think about how to make it practical. The solution to lifestyle diseases is not medication or surgery, but rather addressing and correcting the root cause flaws in one's lifestyle. This is something both patients and their families need to clearly understand. The aim of these videos is to raise awareness about how lifestyle correction can help people overcome various lifestyle related diseases, regain both mental and physical health, and most importantly, sustain that health in the long term. People need to understand that true healing and health maintenance are only possible when the body receives the right nutrients needed for cellular repair, physical and mental activity, not too much, not too little, should be practiced regularly to improve circulation and body function. And harmful toxins entering the body should be minimized or eliminated. It is equally important to spread awareness about the limitations and side effects of lifelong medications and surgeries for lifestyle related diseases. The approach of taking medicines for an entire lifetime to manage lifestyle diseases must change. Everyone must realize the importance of achieving freedom from medications. Remember, if you really want it, there is a way. So don't forget to share this with your dear and near ones who are suffering from chronic diseases, taking medication for chronic diseases, or preparing for surgery for lifestyle related diseases. Through the playlist, you can find videos on this channel covering different diseases, how to recognize the symptoms early, what tests may be required, currently available modern medical treatments and surgeries, their benefits, side effects, and risks, and most importantly, how lifestyle correction help you to reverse the disease process and regain health. You will also understand when clinically supported lifestyle correction becomes necessary. In today's world, a single person may suffer from more than one disease, and for each disease, there can be multiple investigations, medications, and surgical options available. The goal is to empower patients and their families to understand their health condition, the available diagnostic and treatment options, the risks and benefits involved so that they can make the safest and most effective choice for achieving true recovery and well-being. Another important aspect is when someone is talking about healthcare and treatment approaches, you should consider the scientific background of the concerned person. I'm Dr. Jolly Thomson. Started medical education in Government Medical College, Kottayam as 1981 batch and completed diploma and MD in obstetrics and gynecology from Government Medical College, Thiruvananthapuram, Kerala, India in 1992. After additional training in reproductive medicine and surgery, joined government service. Later, resigned from government service and in 1997 started practicing as consultant at Life Care Center, Tevara, Kochi, focusing on lifestyle modulation with the clinical support for lifestyle diseases, minimizing the need for medication and surgery. If you feel that these ideas are relevant in current healthcare and medical care, don't forget to like the video and subscribe to the channel. Feel free to share your thoughts in the comments and don't forget to share this with your family and friends. Thank you.
The informed patient is key to treatment success.